Chapter 1, Anatomy, Physiology, and Disease, Learning the Language. This is the first chapter on our journey through body systems, diseases, and drugs. Please review the learning objectives at the beginning of the chapter. Also, at the beginning of the chapter in your book are the key terms. As seen here, there is also a pronunciation guide. I will go through these terms: anabolism, anatomy, catabolism, diagnosis, disease, epidemiology, etiology, exacerbation, homeostasis, idiopathic, macroscopic anatomy, microscopic anatomy, metabolism, morphology, nosocomial, pathogenic, pathology, physiology, prognosis, rhinoplasty, and syndrome. Part 1. What is anatomy and physiology? It's important to understand the terms associated with studying anatomy and physiology. Anatomy is the study of the internal and external structures of the human body. Physiology is the function and the vital processes of the structures that make up the human body. Anatomy basically comes from a Greek word, but it's about how the body's put together or organized. Specialties in the field of anatomy, we either have microscopic anatomy or macroscopic anatomy. So microscopic, think microscope. So that means very, very small. Can't be seen with the naked eye. We need magnification, like a microscope. So that would include things like cytology, which is the study of cells, or histology, which is the study of tissue samples. Whereas macroscopic anatomy, which is also known as gross anatomy, is something that you can see with a visible naked eye. So that would be a skeletal system, looking at an X-ray, describing the makeup of a hand and the bones located in a hand, for example. Now, physiology, although closely related to anatomy, it's the study of how the anatomical structure, such as cell or bone, would function. So physiology is about the function. It deals with vital processes of life, and there's lots of subspecialties. So anatomy focuses on the structure and how something is put together, where physiology is the study of how those different structures will work together to make the body function as a whole. Design of the structure is often related to its function. So if we think of how a joint works, so the design that it can bend, but its function so that we can walk. So we would look at that. Human anatomy and physiology, or what's commonly known as A&P, forms the foundation for all medical practice. Medical treatment attempts to bring the body structure and function back to the normal anatomy and physiology and how it operates. Now, as we're going through this course, and as we prepare for pharmacology, it's very important that we understand how the body is put together. We also need to understand how it functions normally and what happens when it's not functioning normally, when it malfunctions, when it is in dysfunction. When we have that comprehension, then we can understand how medications can be used to return the body to its normal stasis. All right, so let's talk about some terminology in the studies of the human body. So, study of body function was physiology. All right. So, related to that is the study of the body structure, which is anatomy. All right, so then if we talk about the study of disease, so you've had medical terminology, so you probably know what this term is. The study of disease is pathology. So of course, anything that's the study of generally ends in ology, and patho being disease, so pathology. Now, if we take into consideration the study of the body function when it's functioning normally, physiology, and the study of disease pathology, if we want to talk about the study of the abnormal body function, that would be pathophysiology. All right, let's talk again about some pathology. So, in pathology, the study of the cause of disease, that's its etiology. So, what causes the disease? Is it a bacteria? Is it a malfunction? Is it a chemical imbalance? What's its cause? That's the etiology. Now, the study of transmission, frequency, distribution, and the control is known as epidemiology. Okay, now let's talk again about anatomy. So before I had some slides and we talk about the structure that can be seen with the unaided eye, that would be macroscopic anatomy. And then the study of the structures that can only be seen when magnified would be microscopic anatomy. All right, now the two areas that we talked about on the previous slide in regards to microscopic anatomy, examples of that would be the study of body tissues, which would be histology, or the study of the body cells, which would be cytology. So histo is tissue and cyto is cell. All right, so that is the conclusion of part 1 of the textbook. Part 2 of chapter 1, what is disease? So we've talked about some of the over generalized terminology associated with anatomy and physiology. Now let's talk about disease or pathophysiology. So disease means not functioning properly, at ease, not at ease. Pathology is the study of the disease characteristics, its causes, and its effects. And pathophysiology is the study of the abnormal function of the body. And remember, our goal with medication is return the body back to a normal status. So, as already brought up in the previous slide, terms related to disease, etiology is the cause, and epidemiology is the study of the transmission, frequency of occurrence, distribution, and control of the disease. Now, there's different kinds of diseases. An idiopathic disease is a disease that we don't know what causes it. We can't determine its cause. Unknown. Idiopathic means unknown. In this case, unknown disease, because it's got patho there. Communicable diseases are those that have the potential to spread from person to person or through insect to person contact. So most recently in the news is the Zika virus. So the Zika virus is a communicable disease that spread from an insect to a person. And actually it's person to insect and insect to person. Contagious is readily transmitted from one person to another. And those are tracked by the CDC, or the Centers for Disease Control and Prevention. When we talk about communicable diseases, how they cluster. An endemic are diseases that occur within a specific population or region, and they're pretty well contained. An epidemic is where the disease occurs in large numbers over a specific region. And then a pandemic is when the disease spreads over the country or is worldwide. So right now, we have an endemic of Zika. There's a specific population or region in the U.S. located in Miami, Florida, where they have about 17, I believe, patients who've contracted the Zika virus. We're hoping to prevent an epidemic. We don't want large numbers of people contracting this. In other countries in South America and Central America, they are seeing an epidemic. Pandemic would be if it spreads beyond the countries. All right, so going along with your textbook, the next thing after part 2 is a test your knowledge. So now you have an opportunity to answer some questions. Indicate whether the following examples are gross anatomy, which is macroscopic anatomy, or microscopic anatomy, which is also known as fine anatomy. Viewing an X-ray to determine the type of bone break. Classifying a tumor to be cancerous by cell type. Viewing bacteria to determine what disease is present. Examine the chest for any obvious deformities. The type of anatomy studied by histotechnologists or cytotechnologists. Next question. John was diagnosed with idiopathic respiratory disease. What does this mean? Please give a short answer. Next question. The study was conducted on the frequency of occurrence of a particular infection in South America. The scientists performing the study were called blank, and the cause or blank of the infection was determined to be a type of bacteria. Please fill in these terms. Next question. The spread of avian flu through the world would lead to an and rounding it out, medical terminology is a language of anatomy and physiology and disease, primarily based in medical terminology. Learning medical terminology requires understanding of the root words, root terms, the prefixes, the suffixes, and how they can be put together to form a variety of different terms. Each medical term has a basic structure from which we build, and that is called the root word. Some of this also applies when we start talking about drugs and their drug names. So part 3 is the language. Part 3, we're only going to do a quick overview of Part 3. Common medical abbreviations are extensively used in the medical profession. They're useful in simplifying long, complicated terms, diagnostic procedures, and therapies during required extensive documentation. And you'll learn more terms and abbreviations with each chapter. Now, it is important to state at this time that the ISMP, which is the Institute of Safe Medication Practices, has a list of non-approved, dangerous abbreviations, things that could be easily misinterpreted. It's very important that we are aware of those and we stay away from those in handwritten work. So review this part of the chapter in the book on your own, but please pay special attention to the common medical abbreviations. These are some of the things that you need to know, like DX is diagnosis, CPR, cardiopulmonary resuscitation, BP for blood pressure. So things like that you should know. CVA, MI, NPO, PRN, SOB, STAT. Okay, so we're going to take a break here, and then we will come back and we will cover part 4 and 5 of the chapter.